Hello everyone, my name is Erich as Catig, a caregiving student of St. Augustine School of Nursing, Quezon City. For today's video, we will be doing or demonstrating how to do the suctioning. Suctioning is the mechanical aspiration of pulmonary secretions from a patient with an artificial airway in place. It is the process of removing mucus and fluids from the nose, mouth, or back of the throat with a bulb syringe or catheter. Suctioning clears mucus from the tracheostomy tube and is essential for proper breathing. The purpose of this is to seek out secretions. Then the procedure may differ depending on the client. If newborn or infant, start on the mouth then proceed to the nose, because if you will start on the nose, you will trigger the sneezing reflex and this will result into aspiration. And for adults, suction the mouth first, then proceed to the nose. This is done for aesthetic reason. The materials needed are the following. We have the suction machine or suction connection. We have the connection tubing, the non-sterile gloves, yan cover, water and sterile basin, mask if needed, and clean towel. So for the procedure, we have to assess the client's condition if there is bleeding disorder, epiglottitis, or laryngospasm. So I have to check the client. This is. Then perform hand hygiene. Then we have to perform hand hygiene and provide privacy. Then introduce yourself. Hi ma'am, my name is Erich and I'm your healthcare provider today. We will be doing suctioning today. Are you good with that? I know you have difficulty with breathing. And identify also the client's identity. Your name again ma'am, sorry. Your name and your birthday. Okay, thank you. And then place the oximeter on client's finger and leave the device in place. Okay, and then position the patient into semi-Fowler's position. I'll assist you, ma'am. More. More. Okay, put on mask or goggles if likely. Then prepare your equipment by connecting one end of the end tubing to suction machine. Then turn on the device and set the lowest level. And check the pressure by blocking the airway or the blocking with finger. And then we will prepare now the suction catheter. Then place the drape or rubber pad. And fill the tray with tray compartment with at least 100 ml of saline or normal sterile water. Then open the soluble lubricant. Apply sterile glove on dominant hand and clean glove on non-dominant. And then use the dominant hand to pick up the suction catheter. And then suction small amount of saline from the basin. And then raise the client's prescribed flow rate. And instruct her to breathe slowly and deeply. One inhale, exhale. Then lightly coat 6 to 8 cm or 2.4 to 3.2 inches from the distal end, this is the distal end, with the water-soluble lubricant. And then explain that you will suction from nose down to lungs to help get out from those secretion. Using your dominant hand, remove the oxygen mask. Then ask the patient to inhale deeply. And use the dominant hand and forefinger to insert the catheter gently but quickly as he inhales. Okay, inhale, ma'am. And some more. Do not cover the catheter vent. And follow the course of the nares. Then orient the catheter downward safely. Don't force it. And if you feel resistance, you probably hit the carina. In that case, withdraw the catheter 1 to 2 cm before applying suction. Okay, when performing a nasopharyngeal suctioning, a good general rule is to insert the catheter into the same gap as the distance from the tip of the nose down to mandible. In adult, that is about 6.4 inches or 16 cm, and an older child, 3.5 cm, and for infant is 1.6 cm. Slowly withdraw the catheter as you roll it back and forth. Encourage the patients to cough. Mom, you can cough. Okay, thank you. One more. Alright. And then replace the oxygen device. Perform more than, then you assess for the need to suction if necessary. So are you good, ma'am? Can you can inhale properly now? Are you good? Okay. Inhale, exhale. Okay. And then you can perform not more than 2 passes. Then watch for alteration in the client's cardiopulmonary status by checking it with your stethoscope. And then when possible, allow at least 1 minute suction time before performing another pass to allow for ventilation and oxygenation. And then rinse the catheter and connecting tubing by suctioning normal saline until the catheter has been cleared of secretion. And then detach the catheter from the connecting tubing. And then loop around the finger and pull the gloves inside out to isolate any contaminants. Then remove the other glove and turn off the suctioning device. Dispose all the suction device and receptacles. If indicated, return patient's oxygen on its prescribed level. Remove the drape. And reposition the client as needed. And then perform hand hygiene. The procedure, including your pre and post-suctioning assessment, the amount, the consistency, color and odor of the secretion of the client, the size of the catheter used, and the patient's response to the care. This is very important. So for nasopharyngeal suctioning, if the patient is conscious, neck should be hyperextended, Fowler's position, depth should be from tip of the nose to tip of the earlobe. Then duration should not more than 10 to 15 seconds, and every interval is 20 to 30 seconds. Should be done within 5 minutes. And if the patient is unconscious, flat on bed, with head turned to the nurse, lateral position may be assumed. Depth should be from tip of the nose and to the tip of the earlobe. Duration should not more than 10 to 15 seconds, and interval is 20 to 30 seconds. And it should be done within 5 minutes also. So this is the procedure using the nasopharyngeal suctioning. Okay, so the next procedure that we'll be doing is the oropharyngeal suctioning. So this is oropharyngeal suctioning is suctioning on the mouth area. Okay, first we have to perform hand hygiene. Then of course we provide privacy. Then introduce yourself to the client. Hello ma'am, my name is Erich. I'm your healthcare provider today. So we'll be doing suctioning through your mouth so that you can breathe properly. Okay, so upon checking, I know your name is and your birthday. Okay, thank you very much. Then help the client into a semi-fowler position. So ma'am, putting you in a semi-fowler position. More ma'am. And then apply a pulse oximeter to monitor the saturation level. And then assess the client if she may require suctioning such as restlessness, gargling, drooling, coughing, or gastric secretions. Then drape her neck and chest. So put the drape or the rubber. Then use mask or gown and face mask if needed. And then put on gloves. And then fill the cup or basin with 100 ml saline solution. And then connect one end of the tubing to the suction machine. And then connect the Yann-Kauer catheter. So this is not a Yann-Kauer catheter, so we'll be using a suctioning catheter. It's close to Yann-Kauer. So then check if the suctioning is working properly. Remove the oxygen mask, if it is cannula, leave it in place. So right now our client is using a nasal cannula, so we don't need to remove it. Then insert the catheter into the client's mouth. Then apply the suctioning and move the catheter around the mouth until all secretion has been cleared. So it should be moved along the gap. Then check all the time or from time to time if there are still secretions. Okay. And then replace the oxygen mask if needed, but still, as what I have mentioned, we're using a nasal cannula. So clean the catheter by suctioning water from the basin until all clear with the secretion. Then we have to turn off the suction machine. Then wash the client's face if needed. Then we have to assess the respiratory status. And then repeat the suction procedure if necessary. And then you have to remove the drape. And then store the catheter in clean, dry place. So the catheter is here. You have to put it here. And then help the client in a comfortable position. And then perform oral care if needed. Then discard the remaining water, remove gloves and mask. Then perform hand hygiene. And again, we have to document the procedure including the response to the suctioning, mouth and consistency, color, and odor of the secretion. Okay. Then for oropharyngeal suctioning, this is done if the patient is conscious. Then position the patient in Fowler's head, turn to one side or toward the healthcare provider. Then insertion should be at least 10 to 15 meters. Duration should not more than 10 to 15 seconds and interval should be 20 to 30 seconds. Should be done not more than 5 minutes. And if the patient is unconscious, place on one side, tilt the neck to move head slightly forward towards the basin or to avoid aspiration. Then insertion again should be at least 10 to 15 meters. Interval should be done 20 to 30 seconds and not more than 5 minutes. Okay, that's it guys. We did the demonstration on how to do the nasal or nasopharyngeal and oropharyngeal suctioning. I hope you've learned something from this video and see you on the next demonstration. Bye guys!